Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob. Sorry, Bob.
Okay, that was my bongo drums. Today, we're going to talk about 6-inch foam roller. We're going to show you how to use this to do an entire body, whole body massage.
Sure.
And we're big advocates of this. I use the foam roller every day. Do you?
Not every day, but I use it when I need it, when I like it, and I have it in the clinic because there's oftentimes a number of patients that I get it and use it with, and it works out very well.
I use it just for my mid back every day.
Yep.
I don't usually have to foam roll some other stuff, but when I do, I mean, then it works out really well for stretching it and
Yep.
preventing injury, and even when you are hurt.
But you can go from head to toe, and actually we're going to go from toe to head.
All right.
But there's some people out there, Bob, I've noticed, and they are very...
Oh, yeah. Hi, folks. In case you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, if you haven't already, please go over to the Facebook and sign up and like us, because we like to be liked.
Yeah, I like the Facebook, Bob, and I like to be liked on the Facebook.
All
but
right.
we've got foam rollers to talk about right now.
Let's talk about it.
So if you're going to get a foam roller, you have to be aware that there's more than just one type, and it's just not the colors here that are different. Okay, these are color coded from the company that makes these. OPTPs sell these, and they're good quality. We like them. The black one is very dense.
Yeah,
okay,
very dense.
Yeah, this
I mean,
one
you can't hardly get in on
right.
one.
Now, typically people who like this one are people who are, have a little more muscle. They're bigger people.
Sure.
And that helps get into the muscle and
So that would
relax
be you,
it.
Brad?
No, Bob. I actually, I'll use this one, but this is my favorite one.
This is my favorite one,
right?
too, by
This
far.
one's the medium density. They make a softer one than this, Bob.
Do they really?
Yeah, they do.
Ah.
And this one, the gray one, is in between the two. Okay.
Yeah, I put this one on our site below, on our recommended Amazon site.
Sure.
So if you want to order this one, you can just go down below and hit that link.
Right, and
So-
and it's built well. I mean, it's you can perspire on it, you can clean it. It's done well. So let's show some exercises, Bob. I'm going to go right with the blue one because that's my preferred one. Now the 6 inches actually for the bottom of the foot is probably too big for that. I mean, if you want to roll your bottom foot for plantar fasciitis, you probably want to go with the 4-inch at least.
Or even a ball.
A ball.
A lacrosse
Yep.
ball.
But if you've got some anterior tib shin splints, a muscle right here, boy, you can work on this like this and just roll back and forth. And you can do both at the same time. And if you really want to get after the one side, you just simply shift your weight. And you notice my hands are here and my feet are touching the floor so that I can vary the intensity or the pressure on that area, because if you've got a sensitive shin splint and it hurts too much, you just simply back off on it and then gently work your way into it. And what we're doing with this foam roller is it's like doing a soft tissue massage. It's compressing the muscle, getting the circulation, the blood to flow, and relaxing that muscle.
And I'll attest to this one, Brad. My son's runs in college. He
Sure.
runs cross country, developing some shin splints. We had him do this before he'd go out for his run, because you want to get things all loosened up
Yep.
and stretched out,
Yep.
so they're not pulling on the bone as much.
And get that blood flow working.
So
And
worked
then
out really good for that.
opposite muscle group.
Yep. And this can be also used if you have shin splints. I would do both sides.
Yeah, for sure.
Because you're going to get that posterior tibialis.
And you'll know when you get on that tight muscle, because you'll feel it, and that's where you can work over it. If you're just doing a general massage on this, make sure you get down by the ankle as well, because you want to get on that soleus muscle, which is a deep muscle that oftentimes gets forgotten with stretching, as well as this.
You can make this a lot more intense, can't you, Brad?
Yeah, you
there
go like this.
Crosses over and.
Oh, yes, now we're talking. That muscle's talking to me. It's saying, whoa. Okay, good.
And you can have your partner sit on your leg.
Yeah, I could have my wife sit on her leg, and she'd be happy to make that sing a song to me. Okay, then we might as well go directly up to the hamstring. See how it's so convenient. And we're going to do a similar technique with this. And again, now this one, oftentimes I will go right on one leg right away because it's a bigger muscle. I can tolerate a lot more pressure on that. Now this particular one, I may go with the darker roller.
Oh, really? For a little more intense?
Yep, just because tolerates it more. For me, you know, it's going to be different, but this still does a good job.
Which surprises me, Brad, because you're usually a wimp on this thing. You are.
Wimp? Bob!
You're all going, boy, that's really bad. I'll try and like, what is he talking about?
Well, I didn't think you were going to tell the whole world that, Bob. You know, how am I going to, now what is my wife going to think of me? Okay, and then we're going to go right from there up into the glute muscle as well as the piriformis.
Oh, sure.
Yep. And on this, one side at a time.
Yeah.
I don't think you're going to get both sides at the
Yeah,
same
you
time.
can't get the angle.
Right.
So,
So you're going to angle yourself, and this works really well. This is for me, I'm telling you, Bob, I'm a happy camper doing this one. I could do this for the rest of the video, but you might get bored.
oh, interesting.
Yeah, I do like this.
It is weird how certain muscles, you know,
Yep.
really make you feel better.
And then I got to get the speaker out of the way, and then I'm going to go right to the hip adductor muscle, the one on the side. Now, you can get over the greater trochanter, and there's no sense in rolling over that because you got a bursa on there, you might actually irritate something. You want to get on the muscle, which is right here, but it's down there, of course. And I'm going to roll on that.
Sometimes a little hard to get specific on that one, but
Right. You're probably not going to roll over your iliac crest, that bone right there, the pelvis bone, because that's going to drop you down into your stomach. You know, and if you want to go in there, you can. I personally don't think it feels good, and I usually don't do that, but you could. I don't know, Bob, you ever?
I don't usually foam roll that
Yeah,
muscle.
you know, in the waistline there. But, you know, I guess it's an option. And then from here, Bob, do you do the hip flexor with this a little bit? Or see that as a good option for people?
It's a possibility, sure. I mean, you want to try it or not? You're going, I wish you wouldn't have said that.
Okay, we can, yeah.
Again,
you
you're
know,
going to lay off onto one side.
yeah, so I'm tipping up on one side, and I'm rolling like this. And again, when you do this, you'll get a feel for what works good for you. It's going to feel good. If something hurts, the muscles hurt right away when you do it, but after you work on it for a little bit, it feels better and better. You know you're doing the right thing. Or when you're done, and it feels like, oh, that was really good. You know exactly how you get to learn your body and how to work with the roll. All right.
All right.
This is one of Bob's and I's favorite one.
This is the one I do. I'll do it every morning. And then I also do it if I do a bike ride. I do it before the bike ride.
Oh, really? Yeah.
The bike ride, you're kind of hunched over a little
Yep.
bit. Even though I have high bars, I mean high handles.
When I used to do this one, Bob, I'm telling you, I used to cavitate or crack my back all the time, but not so much anymore. I'm not sure why.
Really? No,
Yeah.
I still do.
Now, one thing that Bob and I both agree on is when you're doing this is avoid going down into the lumbar or the low back. Just above the belt line, typically it's one of those areas that I just don't think that pressure, particularly if you got a back problem, it just isn't going to work.
I haven't found anybody that likes it. Maybe somebody make a comment below that they do like it. and
Right.
Fine. I mean,
Yep.
if it works for you, it works for you. But you're right, Brad. I don't like it either. I don't like even going too far up into the neck, but you do that a little bit once in a
A
while.
little
don't you?
bit. I'll get just above C7, but again, it feels good. I'm not doing anything that
Yeah.
hurts. This is all one of those things that
I stay
feels
pretty
good.
limited right in that
Now,
mid-back range.
This one, I use the black one. It's a little too aggressive on me.
Sure.
I think you have to be one of those really strong
Yeah.
people with a lot of soft tissue. That
This is one where the softer really pays off. Watch for your
yeah.
right there, Brad.
Oh. Now, for that lat muscle right
Latissimus,
there,
yeah.
yep, this works pretty good. You can just go to one side. Obviously, you're only doing one side at a time on this, and use this elbow here. And I get this position, I can really have good control. Boy, she's pointing that camera right at me, Bob. I'm
Yeah.
getting kind of.
What's nice about this, Brad, is that it's been a nice progression, though.
Right.
You know, you just kind of work your way all the way through the body here.
Yeah, for
So-
sure. There-
And, you know, for me, generally the way I use it is I hit trouble spots.
yeah.
I don't generally do the entire body.
I think
But-
this is one of those things, you know, if you really are a patient person, you just want to do it. Or while watching TV, I could see doing this
Sure.
on the floor.
It definitely, you know, when you're foam rolling, you're stretching muscle. So
Yeah.
you are preparing it
Right.
for activity.
Yeah, I'm
So-
feeling good. I actually feel the difference on my right lat compared to my left
Oh, you
right
do?
now. Yeah, I mean, I
Alright.
feel like I should do that one, but I know people are waiting for the next roll, so I'm going to go up into the tricep. And this works best, I find, sitting at a table. And you can work it here, kind of like you're doing this deal. Got your head up. There you go, and I can work right across like this. It works a little better when your elbow is straight, actually, because it lets some muscle in a more of a relaxed position. Work right across there. And if you want to work, the bicep is a hard one to get at conveniently, so I skip that.
Don't know that you need to either.
Yeah. If you want to get the forearms, you can roll like this again. You can do one at a time to get
And
those.
believe it or not, that's not a bad idea, especially if you're having tennis elbow or a golfer's elbow. These muscles in here, although the problem is often felt right here, quite often you got to loosen up the muscle wad, as we call it.
Sure.
So
There. You can do both at once. Boy, I really like this one on the back. I'm going to push here to get extra pressure on it. You really have to get kind of in a weird position to get that muscle wad, or sometimes I call it the muscle belly. There we go. Oh,
and the nice thing about this, Brad, is then when you're all done, you just put it down and you're going to lay down on it. And this is a great stretch to do to finish up with.
You notice how he get on this one? I really wanted to do this one, but it really does. It's a very comfortable way to do it. And also,
let things stretch here.
I think OPTP is the only one that sells this nice, cute little half roll. And what that's made for is it fits right on the roll, and it gives you a little pillow, so to speak.
Yeah, especially if you're a person that can't get your neck back all the way. It works
Right.
well for that. But
You bet.
But this works well for a lot of problems, especially posture problems.
Sure.
Stretch out. So.
Yep.
All
Wow,
right,
Bob,
Brad.
I'm feeling relaxed, Bob.
All right, remember, Brad, we can fix just about anything.
Anything except for,
A broken heart.
all right, look at the cradles right on there. Can you
Yeah.
make that fit on there?
I'll try.
There you go.
All right. Thanks.